Step 7, the 5 and 5 technique. For most people, 5 hours of sleep is the magic number. Completing 3 sleep cycles in a row appears to be critical for feeling functional the next day. With the 5 and 5 technique, you can get 5 hours of uninterrupted sleep plus some additional hours of possibly interrupted sleep. To implement the 5 and 5 technique, think of a night as consisting of 10 hours. For this example, let's say from 9 p.m. to 7 a.m., but you can choose whatever 10 hours work best for you. If you divide that time in half, you and your partner each get 5 hours. One takes the 9 p.m. to 2 a.m. shift, the other the 2 a.m. to 7 a.m. That's the second shift. One of you is on duty for the first half of the night, while the other sleeps sometimes in a different room, and then you switch. Maybe that means you sleep in different rooms and move the baby, or if you're in the same room, maybe you take turns wearing earplugs. I've created a handout to explain this further. I'll give you an example of how this would work. Let's say mom is going to sleep the first shift. At 8:30 p.m., she feeds the baby, puts the baby to bed, and she goes to bed herself by 9 p.m. Dad stays up watching TV, etc. Then at 11 p.m., he gives the baby a bottle for a dream feed, and then he goes to bed, but he's still on duty until 2 a.m. Being on duty doesn't mean you have to stay awake and alert, waiting for the baby to make a noise. No, you can sleep while you're on duty. Being on duty means if the baby wakes, you are responsible for responding to the baby during your shift. The on-duty person does what he can to allow the off-duty person to sleep. At 2 a.m., it's time to change shifts. Dad goes off duty and mom takes over, allowing Dad to sleep the rest of the night. There is some preparation required to implement this plan. If mom is breastfeeding, she'll need to pump and store extra milk for some nighttime feedings. Both parents need to know how to feed, change, swaddle, and soothe the baby. Decide in advance when you will start this plan and discuss where each person will be. Finding ways to maximize each person's sleep. Discuss how you will know when it's your turn to respond to the baby. Make sure both parents know where everything is so no one needs to disturb the off-duty parent. Like all plans involving dealing with children will encounter some difficulties. Talk to your partner about what works well and what doesn't. If one parent is struggling, has a cold, a stressful workday ahead, is feeling depressed, they may need additional sleep some nights. Be flexible in your plan for these times. Sometimes these discussions are really hard for a couple. When a mom is not getting the support she needs to get sufficient sleep, I often write out a prescription for my client to give to her partner. On it, I write diagnosis, profound sleep deprivation. Prescription, please do nighttime duty so she can get 2 nights a week with 7 to 8 hours of sleep in a row. And then I sign it. I have a handout for you for a sleep prescription in case you need it. Step 8. Create a plan for your baby's naps. Newborn babies need a lot of sleep during the day, as much as 7 naps per day. As they get past the 4th trimester, they often develop a pattern to their napping. It's easier to create a schedule. Also, as they get older, your sleep deprivation has accumulated. As you become increasingly exhausted, it gets harder to find the motivation to accomplish anything during the moments you have to yourself. It's easy to waste this precious time on social media and find that you didn't get much relaxing or joy out of it. One way to create more balance for yourself is to have a nap plan. Say your baby takes 3 naps a day. Consider spending one of those naps doing chores and household stuff. The second nap, maybe you take a nap for yourself, and the third, you do something that you really enjoy. This limits the amount of time you spend on chores so it doesn't feel so overwhelming. It gives you permission to take a nap and be good to yourself. Tinker with your nap plan to create a variation that works for you. Step 9, enlist help. We've talked about the 5 and 5 technique to get support from your partner. Another way of dividing and conquering is to have one parent do weekdays and the other do night duty on Fridays and Saturdays. Getting 2 nights of decent sleep a week can really help. If you were blessed to have a super supportive family member who's interested in doing night duty, get their help. If they can't handle the entire evening, you can create a 5 and 5 schedule with them. Any help is better than no help. If you have the financial means, strongly consider hiring a nurse or nighttime postpartum doula. Their help can make all the difference in how you feel. I've seen the stress level in a family go down nicely after a few nights of support. Assuming you don't have unlimited financial resources, instead of having the night nurse or doula come 5 nights a week for 2 weeks, I'd recommend 2 nights a week for 5 weeks. Step 10, avoid over-monitoring. You can actually wake or disturb your baby by checking on them. Electronic monitors can be helpful tools, however, sometimes they can backfire. The sound from monitors can make even tiny movements from the baby wake you up. So turn the volume low so you only hear when they're making recurrent bids for your attention. Occasionally, seeking reassurance can become a compulsive habit. Moms can wake themselves up just to check the monitors throughout the night. Some moms even want to put an oxygen monitor on their baby. Every time it gets disconnected, the alarm goes off. This is a recipe for developing postpartum anxiety and ruining your sleep. If you can't manage to sleep well, even if your baby is sleeping, you might benefit from CBT techniques to improve your sleep or short-term medication from your doctor. If you're nursing, it's important that anything you take is safe for your baby. Step 11. Fostering your baby's ability to self-soothe. Once your baby is a couple months old and gaining weight well, avoid immediately feeding your baby every time he wakes at night. Babies just wake up periodically. They have the REM sleep cycles and frequently have periods of waking in between sleep cycles. Sometimes they need a bit of coaxing and comforting to return to deep sleep. If you assume each waking must mean your baby is hungry, they begin to rely upon the act of sucking to fall asleep. To foster your baby's ability to self-soothe, do the least amount of intervention that helps them get back to sleep. Gradually lengthen the time between nighttime feedings by finding other ways to soothe your baby, such as placing a hand on their chest, using a calm and soothing voice, giving a pacifier, or holding them. Step 12, consult an infant sleep expert. If your baby isn't sleeping and what you're doing isn't working, consult an infant sleep specialist. There are a growing number of training programs for people to become certified infant sleep specialists. These organizations have websites and can refer you to a professional in your area or someone who's available via Zoom. Some of the larger organizations include MommyWise, Family Sleep Institute, Gentle Sleep Coach. These organizations differ by philosophy, as do the individual sleep coaches. Research both the program and the coach to make sure they feel like the right fit for you. Talk to a friend for potential referrals. A good sleep coach should leave you feeling empowered with new skills and strategies. Also, there's some babies that just seem to be bad sleepers. You may do everything right, but nothing seems to help. Be really kind to yourself. Get all the support you can get. If you've ever had a few bad nights of sleep, you might have noticed that you don't always feel better after one good night. It can take a few nights of good sleep in a row to feel normal again. After weeks to months of sleep deprivation, it can take much longer to feel like your old self. With these 12 steps, you have the tools to get better sleep. Keep in mind that even after your baby reaches a great sleep pattern, this can be disrupted. The most common causes are travel, time change, or when your baby gets a cold. Try to coax them back into a good sleep pattern as soon as you can. You may need to come back to this section from time to time, as your baby's sleep is an evolving process.